So now we'll continue with the small saphenous vein. We have seen the great saphenous vein. We'll talk about the short saphenous vein. Okay, so we already seen this is the great saphenous vein here, beginning from the dorsal venous arch, going on the medial side all the way up to the femoral. Then there is a shorter vein which is on the lateral side. This is called as the small saphenous vein or short saphenous vein. This vein is also called as the deep vein of the leg. The other name for this is called as the deep vein of the leg. Okay, so the beginning of this is from the lateral end of the dorsal venous arch. This is the dorsal venous arch, and it begins from the dorsal venous arch and terminates into the popliteal vein in the popliteal fossa below the knee. So if you see here, this goes all the way up to the popliteal fossa. As I said, popliteal fossa is behind the knee joint. So the vein there will be called as the popliteal vein, which will drain into the femoral vein. So the popliteal vein is the vein where this the small saphenous vein or short saphenous vein will terminate. So what are the important tributaries of this vein? One is the communicating branch of the accessory saphenous vein and the perforating branches. There will be perforating branches which connects the small saphenous vein with the great saphenous vein. Okay, deep vein to the superficial vein, because this short saphenous vein is also called as deep vein of the leg. So there's connection between these two veins, and they will be called as perforating veins, which communicates uh, with the great saphenous vein. These are called as perforating branches. Multiple branches are there, perforating branches, as well as the communicating branch of the accessory saphenous vein. So this is about the short saphenous vein. Now coming to the surface marking. We have already covered the brachial artery and the radial artery. So now we have to go for the femoral artery. In the last in the upper limb, we have already covered the brachial artery and the radial artery. So we'll go to the femoral artery and dorsalis pedis artery. So on the foot, so here will be the dorsalis pedis artery. Okay, which is nothing but the continuation of the anterior tibial vein. So this is called as dorsalis pedis artery, a very important artery which the pulsation of which can be felt in the foot, especially in a condition called as TAO, where the veins, it is called as TAO or the thrombus. I just can't remember right now. That will be where the veins will be blocked actually. They are thromboangiitis obliterans, that is called as TAO, thromboangiitis obliterans, where the veins become narrow due to some kind of disease, especially in case of excessive smoking and diabetes. So these artery cannot be felt in those conditions. So this dorsalis pedis artery is a very important artery in the foot, which is used to feel the pulsation and to see the conditions of the arteries and the veins. Okay, especially the arteries, where there will be blockage of the arteries, not the veins, the blockage of the arteries. And here, this is the femoral artery, which we have already seen. So now how to surface mark these arteries? One is the femoral artery, and the second is the dorsalis pedis artery. Femoral artery, as we know, it is in the thigh, just below the mid inguinal point. As we saw, it begins from the mid inguinal point and goes on the posterior surface and continues as the popliteal artery. So how do you mark it on the surface? Okay, so the femoral artery can be marked by corresponding to upper two-thirds of the line joining. So if a line is joined from the mid-inguinal point, because we know it begins from the mid-inguinal point. So if you mark a point on the mid-inguinal point, and the second mark will be on a bony projection on the medial side called as adductor tubercle. If you have studied the femur, you might have seen that there is a tubercle on the medial side of the femur called as the adductor tubercle. So if you join these 2 points, one is the mid-inguinal point and the second is the adductor tubercle. You draw a line from mid-inguinal point up to the adductor tubercle. So mid-inguinal point, center point between the anterior superior iliac spine to the pubic symphysis. So how do you mark this mid-inguinal point? By taking the midpoint between the anterior spine. There is a bony projection here which you can feel yourself. Okay, as well as here in the center we have the pubic symphysis. If you join these 2 points and take the center of that, that is called as mid-inguinal point. There are two terms. One is called as the midpoint of inguinal ligament, and the other is mid-inguinal point. Midpoint of inguinal ligament is the midpoint of the inguinal ligament itself. So mid-inguinal point means if you join the anterior superior spine to the pubic symphysis at the center of the two, that is called as the mid-inguinal. So this is the beginning of the first point, and the second point is adductor tubercle. So adductor tubercle, lower end of the cord tendon of the adductor magnus felt in a shallow groove behind the vastus medialis when the thigh is semiflexed, abducted and laterally rotated. If you want to feel it in a live person, then the thigh should be semiflexed, abducted and laterally rotated. Then you can feel a bony projection here. So these 2 points, if you connect these 2 points, then it becomes the femoral artery. This is how you can mark the femoral artery with an arching towards the lateral side, slightly arching toward the lateral side. If you mark these 2 points, that becomes the surface marking for the femoral artery. Going to the second artery which I was talking about, the dorsalis pedis artery, which as I said, it is very important artery in the thromboangiitis obliterans, that is TAO, where the arteries are blocked because of excessive smoking and other conditions. So, at that time, you are supposed to feel this dorsalis pedis artery. If it is not felt, then there are chances, much likely chances of thromboangiitis obliterans, TAO, or sometimes diabetes also. Okay, so how do you mark this artery so that you can feel it? Okay, so the dorsalis pedis artery can be marked by joining the following 2 points. The first point will be midway between the two malleoli. So this is called as the malleoli, the lateral malleoli and the medial malleoli. So there are two malleoli. In between the two, the center point of the two malleoli. So mark 1 point here. The second point will be proximal end of the first intermetatarsal space. So the first intermetatarsal space between the two tarsi, the great toe and the second toe. Between the two, that space is called as the first intermetatarsal space. So if you point, this is the 1 point. The second point is between the two malleoli, the center of the two malleoli, the first point, and second point at the first intermetatarsal space between the two toes, the great toe and the second toe. So mark these 2 points and take a line from one side to the other side. So if you mark like this straight line, that will be called as the surface anatomy of the dorsalis pedis artery. Okay, so this is how you will mark the femoral artery as well as the dorsalis pedis artery. Now coming to two veins which we can mark, that is the femoral vein as well as the great saphenous vein. Femoral vein, just beside the femoral artery is the femoral vein. Okay, so the marking is quite similar to that of the artery. Mark by joining the following 2 points. First point, 1 centimeter medial to the inguinal point. So mid-inguinal point. As here we in the artery, it was exactly at the mid-inguinal point. So that the vein is medial to the artery, so we'll take 1 centimeter medial to the mid-inguinal point. So we'll mark that so that it becomes vein. Okay, then the second point will be lateral to the adductor tubercle, lateral 1 centimeter, just lateral to the adductor tubercle. Okay, so this is how you can mark the 2 points. Lateral will be towards this side, adductor tubercle will be here. So there it was exactly at the point, these same points, mid-inguinal point and adductor tubercle. Here 1 centimeter medial here on the top, and below we have 1 centimeter lateral, so that it becomes the vein, not the artery, same artery. Okay, quite similar to the femoral artery with slight difference, as I said. So 1 centimeter medial on the upper end, and in the lower end 1 centimeter lateral. The points are same. Okay. Now coming to the great saphenous vein. Great saphenous vein, as we saw, begins from the dorsal venous arch, goes all the way up to the thigh, but it changes its position in different points. So we should know there are 5 points with which you can mark the great saphenous vein. One is a point on the dorsum of the foot at the medial end of the dorsal venous arch. So just medial to the dorsal venous arch, the first point. The second point on the anterior surface of the medial malleus. So medial malleus here. So just anterior to that will be the second point. Third point on the medial border of the tibia at the junction of the upper two-thirds and lower one-third of the leg. So at the junction of the upper two-thirds and the lower upper two-thirds and lower one-third of the leg. So if you mark a point on the medial border of the tibia, that will become the third point. Fourth point at the adductor tubercle. Adductor tubercle. So as we saw here, adductor tubercle, same adductor tubercle will go here. Okay. Fifth point joins below the center of the saphenous opening. So here, where it opens into the saphenous opening, that will be the fifth point. So if you all join all these points, then you can draw the easily the surface mark the saphenous vein on the body. First point here on the dorsum of the foot on the medial side. Second, anterior to the medial malleus. Third is the junction between the upper two-thirds and lower one-third of the leg. Fourth point, adductor tubercle, and the fifth point is on the saphenous opening. So mark the join these all these points, then it becomes the surface marking of the great saphenous vein. So this is all about this lecture, which is the venous, the arterial supply as well as the venous drainage of the lower limb. So if you have any doubts regarding this, you can ask me now.
Doctor,
Yeah,
is this lecture on the model, the updated one, or what?
this is there already. I sent it to Dr. Lamya. She has uploaded this one.
I don't know. Just I want to ask you.
I
Let,
don't know on the Moodle. I did not check. You can just ask Dr. Lamya about this.
okay.
Okay.
Thank you.
I have sent her the she if she has not uploaded, ask her to upload. Okay. Anything else? Okay. Thank you.